In October 2015, Healthwatch Camden issued a report on GP practices in Camden. The study draws on publicly available data and on qualitative research with local people to explore the variation that exists in both patient experience and in the delivery of key services across the 36 GP practices in Camden.
The study can make a difference by putting this information out for the first time in a way the local people in Camden can see. It also provides the GPs in Camden with information as how their performance compares. And because so much effort has gone into the study to make this information readily understandable in a clear way, it will provide the basis for GPs to improve performance. We know within Camden, as in England, there's a north-south divide, so to some extent variations can be due to the local circumstances of the practice. But we also know that practices in very similar circumstances have different levels of performance. So it provides an opportunity for those who are not doing so well to learn from those who are doing really well. There are two different ways you might look at the GP report. One is to look across a whole range of different information and see where practices are doing well and doing poorly. And that will give you an impression as to which of the practices are doing well on lots of criteria and doing poorly on lots of criteria. And typically you find that no practice is excellent in everything, so all practices have got room to improve, and the practices that do poorly on lots of indicators will do well on others. So you get this mixed impression of performance. The other, of course, way you would use it is what matters to you as a user of general practice services. So you would then see how well your local practice compares with others on those criteria. We do not see this being used for people to shop around and move between practices, but it's more in a way in which what we'd want is the practice that's not doing well to respond to the local patients and make an effort to try to improve so they can see that performance has improved in the future.
The Healthwatch report is a really well written and thoughtful report that explains very clearly for people not in health what different measures are and perhaps how they might affect you. So I think that for the general population it's a really useful report. I think for general practices themselves it's an opportunity to look at your own performance, compare it with others, and hopefully start conversations with other people about how they do things differently. I also think it's going to bring up challenge. I think GPs are going to say, I don't like that, or I don't agree with that, or that's not relevant. But I think that that is useful and interesting and helps us all to talk to each other. So I think it's a report that could form the basis of helping us to work together, to learn from each other, and to improve quality across the board. One of the other things is it does look as if patients like smaller practices, and I would infer from that that perhaps they appreciate more personalised care. That's something I think we as GPs and GP practices need to listen to as we move forward in the current climate where larger practices are being encouraged and where the idea is we might join together to try and improve quality. I think we need to bear in mind how do we also keep care personal. There are lots of interesting findings, but I found the information about carers the best and the most useful for my practice because it's new data that's been specifically collected for this report and actually gave me something I've never seen before, whereas a lot of the other data is data I've seen in various shapes and forms. And when our practice discussed the findings from the carers report, it made us really think about how we might do things slightly differently, how we might train our receptionists, how we might raise the profile of carers, and I think that has potentially made a real difference to how we actually provide services in our practice. I think the Healthwatch Camden report can make a difference if practices work together. I think on your own it probably is difficult to work out how you might change. But I think if we use it as we federate and as we work together more, it's something that we might use to draw on and learn from each other. So where the report points out that two practices near together perform differently, that might provoke a conversation about how practices do something. and how they call patients in or how they provide a service. And I think those are conversations I would really like practices to have over the coming years, so that we can keep both a sense of personalised care and the best quality care.